The American Hospital Association's strategic alliance with Unidos US, the nation's largest Hispanic advocacy organization, aims to improve community health across the nation and increase diversity among healthcare leaders shaping the future of care. The Healthy, Equitable, and Resilient Communities Initiative highlights AHA member hospitals and Unidos US affiliates working together to respond to the challenges of disparities, violence, and trauma. This podcast series explains how research helps communities and healthcare leaders meet the needs of those they serve and advance health for all. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, Senior Writer in AHA's Washington office and your podcast host. In this podcast, Research and Policy, How Health Disparities Data Informs Change, we discuss St. Anthony Hospital's Collaborative for Community Wellness, which in 2018 released a report that explores mental health access by zip code. This report found that the zip codes corresponding to high economic hardship community areas in Chicago yielded an alarmingly low ratio of licensed clinicians per resident. Our speaker will provide learnings and key insights on how research is a tool to inform communities and decision makers. Dr. Arturo Carrillo is the Mental Health and Family Support Manager of St. Anthony Hospital's Community Wellness Program. Dr. Carrillo also helps lead the Collaborative for Community Wellness. Also joining us today is Patrick Brosnan, Executive Director of Brighton Park Neighborhood Council, which is an Unidos US affiliate and a member of the Collaborative. Thank you both for joining us. Dr. Carrillo, can you share more about how the Collaborative for Community Wellness research on access to mental health services informs policy changes?
So one of the main initiatives for the Collaborative for Community Wellness was expanding our capacity to do research. So there was a few elements that we were seeing as in partnership with all the providers around the table. So again, the Collaborative for Community Wellness is a collaborative that includes community-based organizations, mental health providers, community residents, and they all have a different viewpoint on what mental health access looks like, what it means, and more importantly, how can we get more resources for the people that, in their opinion and in their lives, are very much needing those services. So we had two priorities. One was to coordinate referrals. We really wanted to make sure that over the different providers who are at the table, community organizations, we all share some level of our resources to each other as a way of making sure that everybody that we're working with, no matter what organization they come to, can access all of our services collectively. So that was one initiative. That being said, I think part of the frustration that all the providers saw and the community partners at the Collaborative was that there's such a limited availability of resources that eventually we hit walls, right? And so part of what we were able to do with this research project was, as I kind of illustrated it to our partners, is we would all get into this helicopter and we would fly up into the air and take a snapshot from that vantage point to see what the access issues are in the entire southwest side of Chicago. We'd come back down to the ground. We would do our analysis of that photo and then share those same research findings with the community residents who live in those areas, who are having that ground level view of the issue. And so what we were able to do with the survey, that we were able to collect, again, nearly 3,000 respondents on their opinion on what mental health access means for them and what the barriers to care are. We were able to take that snapshot of the entire southwest side, be able to divide it up by neighborhoods and make comparisons and really understand how does that look not only on the southwest side, but how does that compare to other parts of the city. And so that was the second phase of our research. After we collected the survey, we also started to map out where all the licensed clinical providers are throughout the entire city. We wanted to create a heat map of the entire city of Chicago to see where mental health providers exist and mapping that out by zip code, right, to be able to see what the density is in various parts of the city. Finally, our third phase was to evaluate the list of providers that the Chicago Department of Public Health had publicized as resources for community residents across the city. So in our analysis of that list, which was initially 250 providers, we were able to whittle that down to 126 providers that reported having access to mental health services, or providing access to mental health services, of which only 19 provided free services. So again, we were really trying to take a real comprehensive look at the entire city out of what started as a regional effort to document what the needs are based on our providers' views.
Patrick, you serve as community leader and mobilizer. Can you describe the importance of having this community snapshot so you can inform those you serve and the decision makers?
It was really eye-opening for so many of the leaders that we work with to really see in stark terms the disparities in the resources around the city and in their own community around mental health care. People knew that they don't have access. I mean, they live it. They recognize it. They know the long waiting lines or waiting lists. They know what it's like to have almost no access to this kind of care. But to see it verified and validated in research like this was really, really eye-opening. And it was also for the providers themselves, because I think that they see that they're doing good work and they know that they are trying as hard as they can to address the needs of their patients. But to see the extent to which the limits of their service delivery system has in the community, it was also very stark. Working with our elected officials, I had an opportunity to educate them and inform them and have them really understand the role that they could play in addressing some of these issues. And I think they stood up and they came to bat for the community, especially, our chair of the health committee and city council, Alderman Cardenas. He really understood early on what this meant for his ward specifically. And that was also one of the things that I think was really important about the citywide approach to the research, was we were able to go ward by ward in the city of Chicago and paint a picture for the aldermen themselves so they can really see what does access to mental health care look like in their wards, in their communities. And that also really helped them understand the urgency of addressing this issue. And so consequently, because of this research, because of the access that we had to the communities, because so many community leaders stood up and so many organizations from around the city stood up, we were successful in helping to move the ball forward towards addressing this issue. We're not quite there. We still need to figure out a way of getting more resources funded by the city into the system, but we're very close.
It's important to highlight the efforts around identifying and addressing health disparities. Dr. Carrillo, can you please share with healthcare leaders key insights of your research around accessing mental health services?
Absolutely. So, part of what sometimes gets lost when we talk about the social determinants of health are the structural limitations of access to care. Unfortunately, we are sometimes bound, as in many cases in this country, by managed care models of service delivery, which, when it comes to mental health access, are real prohibiting areas. One of the things that we have to consider in our research and in our understanding of access issues is cost, for example. When we come to mental health access, cost and the copays that people have to pay or sliding fee scales can become a very big barrier to care. One of the things that we've heard from community residents is, well, I can afford a copay when I go to my annual checkup because that's a one-time cost. But if I'm going to receive therapy on an ongoing basis, that's a weekly charge. And so those copays of $40 to $60 add up and really prohibit people's access to care. That, of course, came up in our findings, where 57% of the respondents were saying cost was the biggest barrier to access. That was by far the biggest prohibitive barrier. By comparison, stigma was only 11% of the respondents, followed by 10% of people saying that mental health services wouldn't help me in any way, right? So when you compare the numbers, you see that social barriers are minimal compared to the structural barriers of cost. The fact that those services don't exist in the areas where people need them. So 38% of the respondents said those services weren't available nearby. And lack of health insurance. We know that for the immigrant community, that's a big barrier to care. So the advice when we come to understanding social determinants of health is not to lose sight of the economic barriers that unfortunately are really prohibiting people's access.
Thank you for listening. And thank you, Dr. Carrillo and Patrick, for sharing your great work about advancing health in America. If you want to learn more about the Collaborative for Community Wellness, you can access the first podcast in this series, Breaking Down Mental Health Access. Also, if you want to learn more about the work that AHA is doing with Unidos US to advance health equity, visit us at www.aha.org/alliances. I'm Tom Hederle, and this has been Advancing Health, a podcast brought to you by the American Hospital Association.